After a much slower than expected COVID-19 vaccine rollout, the Trump administration announced it would release all of its available vaccine supply and then instructed states to begin providing vaccinations to anyone over the age of 65.
So to discuss this now with us, this vaccine rollout, other issues affecting our brave nurses on the pandemic front lines, President of the American Nurses Association, Dr. Ernest Grant. Dr. Grant, thank you so much for being with us. And frontline workers, healthcare workers, are supposed to be the first in line, some of the first in line, but we keep hearing these reports of so many not wanting the vaccine right now, or at least choosing to wait. Why is it that so many of our nurses right now are a little hesitant, at least initially, to take it?
Well, thank you for having me. Actually, nurses are getting vaccinated. And in fact, one of the first Americans to be vaccinated was a nurse several weeks ago. And we're hearing from our state nurses association that nurses have very high confidence in the vaccines, and many have gotten their first vaccines and are eagerly waiting their second one. But for those who are not getting vaccinated, there could be a number of reasons, such as allergies or maybe health concerns or health conditions that they may have that may prevent them from taking the vaccine at this time.
So, Dr. Grant, we've seen numbers that 40, 50%, even 80% in some places are saying that they don't want to take it initially. You're saying you don't find that to be the case with a lot of nurses?
That is not what we are hearing. Obviously, there are some nurses who, they're humans as well. So, they have to make that decision. But the majority of nurses that we have been speaking with and that we're hearing reports on, they are taking the vaccine mainly because they are working closely with these COVID patients and do not want to take the virus home to their loved ones or perhaps risk getting sick themselves.
Dr. Grant, you were a pioneer in all of this because you agreed to take part in the Moderna vaccine trial. Why was participating in that in those early stages so important to you?
Well, I decided to participate in the Moderna trial for two reasons. One, I knew that there was a need for more people of color to participate, and I wanted to be able to do that. And the other, as the leader of the nation's 4.3 million registered nurses, I wanted to set an example for my colleagues, and so that once the vaccines would be approved, that they would not have any hesitancy about that if they realized that their national leader was also willing to take the vaccine during the clinical trials.
Dr. Grant, so much talk early on in the pandemic was about nurses not having enough PPE. We did stories seem like every single day, but are we still seeing that lag in them not having the equipment they need?
Yes, that unfortunately is still happening. And one of the things that we're asking the incoming administration to do is to implement the Defense Production Act so that more PPEs can flow through the supply chain, not only just masks, but here recently, as more and more, as we're going through this third and fourth wave of COVID infection, that's an increased demand on supplies such as gloves as well. We're hearing from a number of our states that there is now a glove shortage that is going on. So with the implementation of the DPA, we'll be able to get more of those critical resources in the supply chain and into the hands of the healthcare personnel where they can be used.
I'm curious, is it your experience, have you seen that this pandemic has inspired more young people to pursue the profession of nursing, or has it dissuaded them because of the risks?
It has actually, what I'm hearing from nursing schools across the country is that there's an increase in their waiting list of people who want to become nurses. I think this is similar to what we experienced with 9/11, when a lot of people decided to join the military as a patriotic thing to do. I think now people are realizing that this is an opportunity for them to be able to serve their fellow man as well, which is wonderful because there always was a nursing shortage, and this pandemic has certainly created an even larger nursing shortage. So I am grateful that people are choosing nursing as a profession that they'd like to go into.
We are certainly grateful as well to all of the incredible nurses out there. I know so many of us have relied on them throughout the years to get us through the toughest times in our lives. So our hats are off to you and to everyone who is a nurse. Thank you so much. President of the American Nurses Association, Dr. Ernest Grant. We appreciate your time and we appreciate you.
Thank you. Thank you for having me. Go get that lottery ticket.
See, I will.
in.
Thank you. All right, Dr. Grant told me to. I'm doing it.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.